Good evening, ladies and gentlemen. Welcome to SierraCast COCORIOKO TV. Here is one of our regular programs. Today, we have here in the studios with us the Deputy Minister of Health and Sanitation, Honorable Madina Rahman. She is here to attend a meeting at the United Nations. Good evening, Honorable Rahman.
Good evening.
Welcome to our program.
Thank you.
What is the purpose of your trip to the U.S.?
It's a meeting that was called by the UNFPA.
Okay.
This is a follow-up meeting from a meeting we had in Senegal in November of last year, which drew members from about 15 countries and over 400 invited guests with faith-based organizations and traditional leaders to see how they can contribute to nation building. Also take the lead on many issues related to reproductive health, including family planning, youth development, etc., and see the opportunity to build on the existing efforts and scale them up to support the demographic dividends agenda. Country experiences shown that faith-based organizations are making significant contributions in increasing universal access to reproductive health, and equality for girls and women. That faith-based organizations also play a key role towards the achievement of the demographic dividend and contribute to the realization of the Sustainable Development Goals.
Okay, that's very good. That's it looks like a very good meeting. But then how is it going to filter down to our faith-based groups in Sierra Leone?
Yes. We had a consensus. Our faith-based leaders were also present at that meeting in Senegal, and we came to a conclusion that UNFPA would support all the 15 countries in Africa to make sure that they realize this goal. But UN was planning to cut some of the funding, so we had to come make a case that it's really needed. I even brought the situation of how the faith-based and traditional leaders helped during the Ebola outbreak, and were able to turn the outbreak around with their interventions and community engagements.
Okay, so when the faith-based individuals handle an issue, is there a difference between how they impact on the people and what other organizations do?
Yes, there's a great impact when faith-based leaders or traditional leaders actually pass on the messages. Because, take for instance, if a faith-based leader tell a family, you don't have to have so many children, and give them the reason that you need to have enough children that you can care for, provide education for them, and build them up into responsible citizens, the message goes down well. If the government says it, say, do not have so many children, they would listen, but it wouldn't sink as well as when the religious leader tells them. Because if you know, not only in Africa, people do believe and trust their religious and traditional leaders.
Yes, yes. Okay, we're going to talk about Sierra Leone's post-Ebola recovery program. Listeners know that we just came back from the Ebola outbreak. Now, what do you have to tell us about this, about the government's post-Ebola recovery program? How is it going?
It's going pretty good. We have put quite a bit of modalities in place right now. One, we have to maintain a resilient zero. And in order to do that, we have to make sure we have proper infection control measures all over the country, and especially in our facilities. We also have to make sure that, you know, we have triages all around the country, and especially in our health facilities. You know, we have to make sure we strengthen the qualifications or the output of the nurses that we have. So all those are being put in place. We have to do continuous in-servicing and training to bring them up to speed so we could get a resilient health system. Another area that we're looking at is the maternal child health. Infant maternal mortalities that are all-time high right now. So how can we be able to, you know, bring that number down to actually, if not to zero, to a decent number. So all those things we're looking at, and we were able to identify some of the causes of the maternal and child death. And that's a step in the right direction, and we'll be able to tackle those areas that we've identified.
Now, we all know that Ebola took us by surprise. Have we reached a point where that surprise will not be forthcoming anymore?
Yes. Ebola took us by surprise because we had this fragile healthcare system. And I believe we have to strengthen the healthcare system, and we have to strengthen the base of healthcare. Because regardless of what we do now, if we do not strengthen the base, we cannot build on top of it. So that's what we're focusing now.
All right, that's good. Thank you very much for that answer. And I want to ask a question on the state of our healthcare delivery system. Our listeners will be very interested in knowing the status of our healthcare delivery system after Ebola. What do you think much improvements have been made since Ebola came and took us by surprise, and it affected every system in the country? So is our healthcare delivery system in a situation where it can progress without any after effects from Ebola?
We are building on the healthcare delivery system right now. I wouldn't say we're actually where I want to see it yet, but we're moving in the right direction in terms of strengthening the health system that, as we know, has been fragile for a very, very long time. And this gives us an opportunity to see all the gaps and to see how we could actually build and make things a little better.
Well, thank you very much for your answers. I see you are very comfortable in your position, in your new position. What prepared you for the kind of attitude you have towards your job, your performance level? What prepared you for that? It's very impressive.
Yeah, I would say whatever you do in life, you have to do what you like. You have to do what you're passionate about. And if you're passionate about something, it's half the battle won. Because you do it with ease. You do it with the kind of energy that people would not even imagine. So, you know, as I said, I was here in the States for over 30-some years. And if you could think, well, I've seen myself do one job in the United States. I've always done 2 or 3 jobs. And because I enjoy what I'm doing. One, if you're passionate about what you do, whatever the benefits would follow.
Definitely.
It would follow. So I've been passionate about healthcare, And my satisfaction is to see that other people benefit from what I do.
Okay, thank you very much, Madam Madina Rahman, Deputy Minister of Health of the Republic of Sierra Leone. This is a short interview. She'll be leaving the shores of the U.S. tomorrow, and you had a long day at the UN today, so I know I don't want to bother you with too many questions. We will continue this interview when next you are here. Thank you very much for coming.
Thank you.
Okay, bye-bye.